Welcome to the Food Junkies Podcast. Here, we aim to bring you the experience, strength, and hope of professionals working on the front lines in the field of food addiction. Our mission is to educate you, the listener, and increase overall awareness about food addiction as a recognized disorder. Here, we discuss all things recovery, exploring the many pathways people take towards abstinence in order to achieve a health-forward lifestyle. We hope to inspire you to thrive rather than just survive. So stay positive, make a change for yourself, and share your journey with others. And hopefully the message will spread.
Welcome to today's episode, brought to you by Sweet Sobriety, an online platform that supports individuals in food addiction recovery. Sweet Sobriety offers a wide range of expert-led courses, community support, and tools to build sustainable recovery and long-term wellness. Be sure to check the show notes for more information. Hey there, Food Junkies listeners, Molly here, and I'm excited to be joined by Dr. Laurie Marbas, a board-certified family physician with over 20 years of experience specializing in plant-based nutrition. Dr. Marbas has helped countless patients reverse chronic diseases such as diabetes through the power of food as medicine. She's the co-founder of Plant-Based Telehealth, a leading telemedicine service offering plant-based lifestyle care across the U.S. and internationally. Today, Dr. Marbas will share her expertise on how hormones, particularly during perimenopause and menopause, impact overall health and how lifestyle choices can influence these transitions. Welcome, Dr. Marbas. Thank you so much for being here with us, Dr. Marbas. Am I saying that correctly?
Yes, absolutely. Thank you for having me.
You're so very welcome. I should have asked that before I hit record, but here we are. So we're just going to jump right into it. I reached out to you because I actually had somebody reach out to me asking me some questions. They were in need of help. And it really got me thinking, we haven't talked to anybody who's an expert in this area. And so I reached out to a mutual colleague, David Wiss, and he suggested that I reach out to you and have you really talk to us about some of these questions that are coming up for our clients with things like who are going through things like perimenopause, menopause, have syndromes like PCOS, and in combination then with food addiction, sugar addiction, whatever label we want to put on it. So I'm just curious to know, can you explain how hormones affect women's overall health, particularly during the transition from perimenopause to menopause, and how those changes might manifest like in the day-to-day?
Yeah, no. So I just want to say thank you for having me. I'm looking forward to our conversation. And it's an interesting question because, honestly, I think every woman is going to go through their own journey, right? So it may be a very simple transition and they're like, oh, look, I'm perimenopausal or I'm perimenopausal because things are changing a little bit. Then there's others who have a much more devastating journey, right? And so then there's everything in between. So there are well over 30 documented, well-researched symptoms of perimenopause and menopause. And so many of them just focus on the hot flashes, which in and of themselves is difficult, but there's joint pain, there's difficulty sleeping, there's, mood swings, there's all sorts of stuff. So, hormones, they just play such an important role in various bodily functions, including your mood, right? Your energy, your metabolism. And during that transition, you can see a lot of things happen. So, what's happening is you have estrogen and progesterone decline, right? So then that can lead to the most obvious ones like the hot flashes and the night sweats and the mood swings and the sleep disturbances. But again, you can affect your cognitive function. There's a great book called Menopause Brain. I'd recommend people check it out as well. And just understanding just how this impacts just the brain alone, right? But you can have brain fog, memory lapses. Of course, then you're going to notice things that come along with aging, skin elasticity. You'll also see some weight distribution changes. So from going from, storing fat under our subcutaneous where we normally see it to more kind of in that middle that women describe as belly fat. And then, of course, there's concerns about your bone density. As you enter into perimenopause, you get a rapid decline in your bone density, which is a really big deal. Unfortunately, we don't have discussions with younger women about their bone density because really, if you think about it as a bank account, we really rack up and save until about age 30. And then we see this steady decline, more rapid loss during perimenopause, and then it just kind of slows down again in postmenopause. And so those are the things that should be discussed in women's health early on. And I think, as women, we've kind of gotten a bad rap in the sense of, research hasn't focused on our health and we just kind of been put on the back burner. It's like, oh, just suffer through perimenopause, menopause. And my own story is, I'll be 54 in October. And so last year, I understand there was some perimenopausal things, periods were changing, but I ran a half marathon with my daughter in Boston and I was doing great, had a PR, and wow, it hit me like a ton of bricks. Hot flashes, difficulty sleeping, mood changes, joint pain was the biggest one though. I felt stiff and I was like, what is going on? Because I'm doing everything I tell my patients to do. And that really got me deep diving about a year ago to really focus in on women's health and the menopause, perimenopausal transition and saying, hey, this is more than just lifestyle. There's some serious things we need to speak about. And what does the research say about hormonal placement and stuff like that? And so it's a conversation that's very well needed, especially in this lifestyle, because I think some people feel like they can only do one thing. Like I should only be able to do natural, exercise and eat well, and that'll take care of everything. Sometimes, yes, absolutely, but not always. So they shouldn't feel bad about asking for help.
Absolutely. So in thinking about these 30 different symptoms and knowing that there are different things, interventions that we can do to maybe help ease that process, I don't think that we can totally avoid it. Maybe I'm missing something.
Some women, I've had women that'll say, I didn't have any symptoms. They just periods stopped and they just glazed right through. And I was like, well, God bless you, because honestly, that is the rare exception, at least in the United States.
Got it. Okay. So how then do lifestyle factors like diet, like exercise or stress management then impact the severity of those symptoms and that overall hormonal health?
Yeah, absolutely. So I think, absolutely, when you don't have a healthy lifestyle, that's going to worsen symptoms, right? That's going to really amplify symptoms that you might have. And I think that goes along with anything. So when you think about lifestyle factors, they have a really serious, significant impact on menopause symptoms and really just, again, overall hormonal health, right? So you really want to focus on a balanced diet that's rich on whole plant foods. Specifically, I love plants, but, at least whole foods in general, staying away from the ultra processed foods, regular physical activity. But in this perimenopause, menopause timeframe, it's really important for that resistance training, things like that. We really think about effective stress management, and that really can mitigate so many symptoms. But another component of the plant-based diet is you're going to get in certain foods, you can get phytoestrogens, right? So these are found in soy products, flax seeds, whole grains, things like that. And then that can really kind of help balance some of the symptoms that you're having, estrogen levels. The regular exercise, you can see an improvement in mood. You'll get better sleep. Your energy will increase. You become more insulin sensitive. That will help manage weight. And then stress management things, I would encourage you things like mindfulness. Some people like yoga, meditation. Those will reduce your cortisol levels, which again may help with some of those hormonal imbalances, but that'll help with anxiety and sleep. But then altogether, they just kind of help that transition through menopause be a little bit more easy to deal with. And I think it's really interesting because not only in women in this age group are we dealing with, perimenopause, menopause, but many of them are dealing with chronic disease. And so you have one layer on top of another that just makes someone feel really miserable. And I really do believe that in the United States, we've forgotten what it feels to feel normal. What does it feel good to live in a healthy body and live in an environment that's not chronic stress? Because there's just so many things. I could talk about an hour just for that, but that would be my initial thought around the lifestyle factors anyway.
So when you say, stay away from those ultra processed foods, whole plant food base, or at least whole plant or whole food base diet, what is it specifically that and understand, just clinically speaking, or, from working with patients, what is it about those foods that maybe makes it worse or harder about that whole process? Is it how it impacts the hormones, or is there something else going on there?
There is a very interesting thing. So, if you're dealing with ultra processed foods, I guess it really depends on a variety of factors. So when you're going through perimenopause, menopause, there's already some lack of influence of estrogen, progesterone, and some other things. So now you're bringing in, and you become more insulin resistant. So now we're bringing in ultra processed foods, right? So this will wreak havoc with your insulin sensitivity. There's weight gain, which perpetuates a lot of different things. And then women eat many times because of, maybe they're dealing with stress, or, maybe they again have like the food addiction piece or whatever. there's an unhealthy relationship with food, right? And so we're not eating when we're hungry. We're eating out of something else. We're trying to feed something else. And so that is very, very common. Many people switch to a whole food plant-based diet because they want to lose weight and feel better. And one of the things they notice most is how much better their mood feels and a lot of things. But when you're dealing with this perimenopause, menopause, like I said, it amplifies the inflammation that's already occurring. And so these ultra processed foods are affecting a lot of processes, right? So the insulin sensitivity piece, the inflammation piece, and again, that just contributes the microbiome changes, which again, it's a very complicated system, but it's one thing after another, but it's layered upon layers. So if we work on the foundation by feeding the body well, moving the body a little bit, dealing with some stress, those things start to get so much better. And so that's what I tell people, let's take care of the basics and then we'll see what's left over. And that's where the place where medication might be helpful for women who are doing everything right, or at least trying to, and still struggling. So that's where the conversation goes with medications.
So I've got two questions now from that. One, I guess the first being, if somebody's listening who is through menopause, they're on the other side of it, and maybe they're thinking like, oh, maybe then junk food or ultra processed foods, it's okay if I eat them because they don't impact my hormones. Is that true? Or does it still contribute to that inflammation and hormone dysregulation?
Yeah, 100%. Right. Just because you're not making as much estrogen or the progesterone, there's other factors here, right? We've got the inflammation piece is really, they consider the root of chronic disease. And so these ultra processed foods, they're not even, I hate to even call them foods, they're Franken-foods, right? So these are chemicals that are literally created by corporations who spend billions of dollars to make you addicted to these foods, right? So these are not the foods that you're a normal human being in a natural setting, meaning, let's say 2,000 years ago, is going to be able to walk through nature and pluck off a tree or pull out of the ground, right? These are foods that have words that I would probably need to go back and change my biology degree to some chemical degree just to understand what they are. And we're putting those in our body. And so we cannot think that that's not going to wreak havoc on a system that's very, very finely tuned.
Absolutely. And then thinking about, you were saying that sometimes then we're doing all the things where we've made the lifestyle changes, we're trying, we're still suffering. And now maybe the conversation has to change to something like medications or even supplements. What would that kind of conversation sound like? Or how might you direct somebody to start asking those questions if they feel like they are doing all those things and they're still struggling?
Yeah, I think there's a few really important factors to discuss here. Number one, you need to speak to a physician who's well-versed in the more recent research, right? So the data from the Women's Health Initiative that was presented in 2002 has been retracted in many ways in the sense of how it was reported. The data was misinterpreted and given out to, I think, practitioners way too soon, right? So now we go back and we look at it. The data is showing there's a window of opportunity where a majority of women can start hormone replacement therapy and do it very safely, right? So this is going to be under the age of 60 or within 10 years of menopause. That conversation should also rotate around any personal risk factors, right? So if you have a history of breast cancer, if you have other types of history of other hormonal types of cancers, this is a discussion, again, that needs to be discussed with someone who understands the research and understands your personal risk factors, right? Because as with anything, medications do come with risk. I personally chose to start hormones, so estradiol in a patch. A transdermal delivery system doesn't have the same risk factors that the oral estrogen, which was actually taking horse urine and concentrating it. That was in that study. Is very different than the estradiol that we use now that is derived from plants and in the lab synthesized to be identical to what you produce. And I'm not talking about compounded hormones. This is FDA approved, write it from your regular pharmacy, and also the progesterone. So many people are kind of swayed by advertising where it talks about bioidentical hormones, and they go to these compounding pharmacies. There's a very serious danger in doing that. Number one, these are not regulated by the FDA. I'm talking about prescriptions that went through FDA, the cycle of having to be approved. And, these are safe medications in the sense you know what you're getting. These compounding pharmacies, you don't know what you're getting, right? So you just have to trust that this is exactly what you're told you're given is given. Many times they also give high doses of testosterone that are unneeded and can have potential side effects. Again, this is a conversation I would stay away from any compounding pharmacies and just speak to someone who's clearly well-versed in understanding what menopause is in the setting of your personal risk factors and, looking at your personal risk factors, even if you have some, this is a conversation that this is at the end is really helping you live the quality of life. Some women are suffering so much that they're willing to take some risk. And so again, this is a conversation. It's a very personal discussion, and there should be no wide sweeping like, oh, women should never have access to this. This is ridiculous. You tell a man they can't have access to testosterone when they get older, there would be a war on our hands. But women, we just take it, and women have been suffering for 2 decades unnecessarily. And it's just blows my mind. But for me, coming from the lifestyle medicine piece of it, some people are taking back that I do embrace, the hormones and speak about it, because they're like, oh, this needs to be all natural. Your body's natural. This is what's what. But there's only, I think, like 3 or 4 animals, including ourselves, that actually live long enough to go through menopause. So this is a conversation, again, that really should be taken. And just because someone has some belief system or some dogma or some thinking that there's some expectation that they have to live up to, and that you're a bad person if you choose to use medications to make you feel better, it's insane. And so, again, these are conversations that need to be having, and we should be having them in a setting of people being open and thinking and changing and looking at the perspective in an evidence-based way, so people have options, right? It's just be like me saying, oh, you only get medication, but there's no, never telling someone about lifestyle that can literally reverse type 2 diabetes or their hypertension. I mean, it's insane to me. Why would I withhold, medications that might be life-changing for someone as well? So that's kind of the message that I'm trying to get out to people.
Yeah, absolutely. And then when we had talked about exercise, you had said that bone density, we don't talk enough about bone density with younger women. And then we start to see that decrease as we get older. And then it's impacted even more so by these hormonal changes. So what can we do about the bone density? Does exercise play a role in that? And if so, are there specific things that we should be doing maybe more of?
Mm-hmm. No, absolutely. I did. I run a thing called the Healing Kitchen with my friend Brittany Giroudi, and we meet weekly. And we talk. She shares delicious recipes, and I answer medical questions. And then every month, except for the last 2 months, I've transitioned to living in an RV full time, and kids have gotten married and stuff. So it's been a little crazy. But usually, I do a workshop every month for our members. And one of the main questions was around osteoporosis. So I love creating ebooks. So I did this whole thing. So if you become a member, that's how you get access to all these things. And so the osteoporosis was really fascinating. So when you dive into it, a typical person's experience or patient, let's say that someone is diagnosed with osteopenia or osteoporosis, the typical behavior of a physician, a primary care physician. I am a board certified family physician. So I've been practicing for 2 decades. I understand the training, and my daughter is a physician. So I understand what they do. We go in, and what I mean by they, myself included back in the day before I understood, would write you a prescription for a medication and say, here, they may or may not even discuss the potential side effects, right? But when you look at the guidelines, there's some very specific risk that we need to be calculating, right? So if you have a particular FRAX score, it's FRAX. You can actually go look at there's calculators online. You can determine what your risks are. Now, if you've had what we describe as a fragility fracture, you've had a fracture because of osteoporosis, that's a different conversation. All stops should be pulled so you don't fall again, because so many times you'll see someone fall, have a hip fracture, and that is the downward spiral to death, right? There's a lot of mortality and morbidity that comes with that. So we want to avoid that at all costs. But when it comes to exercise, that's just one piece of the puzzle, but it's a very important piece of the puzzle. So remember that your bones are dynamic organs, right? They respond to stress. And so when you think about what type of stress, we want to do resistance training or weight-bearing exercise. So resistance training is going to be move something heavy every day, right? At least, use your body, but typically 2 to 4 times a week in a structured program if you want to do that with progressive overload. So it's really important that we exercise, and we do these exercises. We're using our big muscles. We're not just doing, biceps. We really want to do things like deadlifts and squats and, overhead presses. So we're causing some type of stress on those bones. And it's not just, 5 pounds. No, you might start off with 5 pounds, but each week you add a little bit more. And you might want to work with a physical therapist if you have a history of osteopenia or osteoporosis before you lift weights, because we want to be very careful that we don't cause injury. But if you're healthy and your bones are healthy and you've had a DEXA scan and you're like, hey, there's no osteopenia, osteoporosis, absolutely, you can work with a personal trainer. I think that would be, their education level would be sufficient. But you want to move those big and be consistent in the program. You can't just like, oh, okay, I lifted this week, 2 days, I'm good. And walk around and think, oh, there's nothing else. This is a consistent behavior. Now, if you don't want to go to the gym, like I am not a gym rat, but so there I have bands, but you can also do weights. So I was in the Air Force and, you trained with different things, but there's a thing called rucking. And so basically you put on a weighted vest. You could start with a very low amount, like, 1 or 2 pounds or even heavier, and you walk, right? So walking is one, you're getting your cardiovascular fitness, you're moving a heavier load, and there's that, that downward stress, right, into the spine, into the hips. That is going to be fantastic. But there's other things we need to pay attention to, right? There's the micronutrients and other macronutrients. You want to make sure you are getting enough protein. On a plant-based diet, you more absolutely can do that, but I would say you want to hit around 1 gram or more per kilogram of body weight each day. And then along with that, make sure your vitamin D level is good, above 30 when you check it on your labs. Making sure you're getting at least 1,000 to 1,200 milligrams of calcium in your diet. Try to stay away from the supplement, just because large amounts of supplements can cause actually higher risk of cardiovascular disease, right? So we want to be very careful about supplementation. Vitamin D, if you're deficient, you should absolutely supplement. And the other things that come along with this, when you are diagnosed with osteopenia, osteoporosis, don't just assume it's because you have been through or around perimenopause. Make sure that they do a full entire workup, right? So that we're not missing something, right? So again, paying attention to your parathyroid hormones, your thyroid, just looking and just doing a good cursory evaluation to make sure we're not missing some other root cause, especially if you're young. And if you are young, let's say that you're under age 40 and you had, let's say you had a hysterectomy and you went into early menopause, you should be on HRT early, right? You should do that intervention. That's going to save your bone. It's going to decrease your risk for cardiac disease and other things. So there's so many factors here. The other thing is there's a really important food that I would encourage is soy. If you're not allergic, to include soy. Soy has been proven. I don't no idea where this came from, but there's so many bloggers or influencers will say that soy is bad for you. Soy is not bad for you. If you look at the data, it decreases risk of certain cancers, including breast cancer, it decreases risk of recurrence, and it increases the risk of survivability. So there's so many things that come with these phytoestrogens, and they think phytoestrogens, oh, that's like estrogen. It's going to do bad things to me and my body. Let's look at what phytoestrogens are, right? These are plant-based estrogens. They're 1,000 times less able to do things like in the body that a typical your estrogen do. So they're weaker, right? So think of this as taking a baby dose of an estrogen, but even then it's very different because depending on the tissue and the type of receptor, there's 2 different types of estrogen receptors. There's the alpha and the beta. The phytoestrogens prefer the beta. These actually have what we call an agonist effect, right? So they act like estrogens where they improve your bone health. They decrease your risk for breast cancer. They help your liver health. And then in some tissues, they actually act as antagonists. So now we have attached ourselves to, let's say, some tissue in the breast. And because it's so much weaker, right, we're decreasing the influence of our native estrogen. So that actually protects us, right? So again, there's these different type of estrogen receptors, the different tissues that they're in, and the intensity of the action of the actual hormone. So really need, again, to speak to someone who understands before they like, oh, you shouldn't be doing soy. I'm like, where did you get this information? Did you read a blog? And there are doctors who will tell you these things. And so it blows my mind. I'm like, let's do some research. Let's do the right thing, get educated, and then we can speak to our patients in a manner that they deserve, right? So they come to us trusting that we know what we're talking about and that we're just not, pulling stuff out of our rear end. It drives me nuts. But anyway, yeah.
Absolutely. I know you were saying the thing about soy, and I remember I was diagnosed with PCOS when I was 28. I'm 41 now. And I remember reading something that I shouldn't eat or drink or consume soy in any way, shape, or form. And so I never have, to the best of my ability. I mean, I do eat edamame and that kind of thing from time to time, but I'm thinking like, I don't even remember where I got that information. I don't even remember now. I mean, that was so long ago. But yeah, so now I'm going to go back and take another look at that. So what are, switching gears just a little bit, what are the most common hormonal imbalances associated with PCOS, and how do they contribute to cravings or food addiction behaviors? And maybe we should even say what PCOS is first, because we haven't done that.
Yeah, so that's polycystic ovary syndrome, right? So PCOS, pretty common in younger women, especially if you're overweight and some other things. But it's characterized by an imbalance in hormones, like your insulin, your androgens, like testosterone, and sometimes estrogen, right? So what happens is high insulin levels lead to insulin resistance, which can cause blood sugar spikes, crashes, and that can trigger like these really intense cravings for like high sugary, refined carbohydrate type foods, which again have been created to make you want them and want more of them. And then elevated androgen levels, basically that testosterone can affect your mood, your energy, can contribute to emotional eating. And then again, you just create this cycle where the cravings lead to overeating, which exacerbates insulin resistance, which kind of perpetuates the symptoms of the PCOS. So it's like this vicious cycle that you feel like you can never step out of.
So if I understand correctly, though, with PCOS, and again, this is my personal lived experience, and I'm imagining a lot of people have gone through this, you're diagnosed with it, and then nobody really wanted to do anything about it until I was attempting to have children. And then it was dealt with. And then I say,
right.
Air quotes.
Yeah.
Yes. Yeah. I ended up being put on metformin and maybe something else. And that ended up working for me for the 2 times that I wanted to have children. But I know others have had to go like through IVF, like it just gets progressively like more aggressive in the intervention, depending on the individual. Absolutely. And then, then I was done having babies, and now it's kind of like nobody wants to maybe like address it. And I know that it doesn't just go away. It doesn't just go away when we go through menopause. It doesn't just go away. So what are like some of those long-term health risks, and how can we be addressing them? Let's say we're in between having babies and the rest of our life or the end of our life. What are those long-term health risks, and what can we be doing to maybe mitigate them?
Yeah. So, I mean, that's a really important topic, right? Is that we give you, like, let's say someone comes in for hypertension, we give you a prescription, but nobody talks about root causes, right? So let's think about the longer term risk factors. So, basically you have symptoms like irregular menstrual cycles, right? So that's why you're struggling for, infertility issues and such. You have weight gain, which again leads you to these other potential risks for development of other chronic diseases, right? So you have insulin resistance, right? So when you have insulin resistance, the body cells don't respond very well to insulin. So that can lead to elevated blood sugars. And over time, that insulin resistance progresses to prediabetes and type 2 diabetes. And so women with PCOS are at much higher risk of developing type 2 diabetes. And that's why it's such an important piece here is looking at the lifestyle factors that will help prevent it, because all the lifestyle factors that will help decrease risk for type 2 diabetes will help PCOS. But we can go on. So like we also have like cardiovascular disease. This is the number 1 killer of men and women across the country. So because you have obesity, you have typically some hypertension, you may have dyslipidemia or abnormal lipid panel, like you have high cholesterol. And again, along with insulin resistance is tied to many, many things. You're at higher risk of what we call atherosclerosis, right? So those risk factors increase the risk of developing where the arteries become basically clogged with fatty deposits. And that can lead to a heart attack, more heart disease, stroke, things like that. It's just something, again, to pay attention to. You're also at a higher risk for endometrial cancer, right? So you have basically women who have infrequent or absent ovulation, or what we call anovulation, that leads to prolonged exposure to what we call unopposed estrogen without the balancing effect of progesterone. Because in a typical cycle you have, it's like you can think of a conductor, right? So you have a conductor and you have the different instruments and they're coming in at different times and they're loud and then they soften. So think of it that way, right? So if you don't have that normal flow of your menstrual and the hormones going up and down, you don't have that balancing effect progesterone. So that hormonal imbalance can cause the endometrium, which is the inside lining of your uterus, to become abnormally thickened, right? And so that increases your risk of endometrial cancer, or what we call endometrial hyperplasia. So there are some things that we want to pay attention to. And then, of course, you have with the obesity, so many things come with that. Metabolic syndrome, which again is cluster heart disease, it's stroke, diabetes, high blood pressure, high cholesterol. Of course, we talked a little bit about the infertility, because with the PCOS, you just get this irregular absent ovulation. And so that can really have you to have difficulty, obviously, with conceiving. And then you worry about also the complications, right? So once you do get pregnant, you're at high risk for things like gestational diabetes, preeclampsia, preterm birth. And I think mental health components of this is many times not discussed, right? So you can get depression, anxiety, because you will have a higher prevalence because, again, a lot of inflammation, hormonal imbalances, body image concerns, psychological stress of dealing with a chronic disease, not being able to conceive. I mean, there's so many things that can lead to eating disorders, more weight gain. You get hirsutism, which is that excessive growth in the facial growth, especially hair growth. So many things then you can also think about some other things, maybe less talked about, sleep apnea, right? It's common because also, again, with that, you get some irregular breathing at night can further exacerbate insulin resistance, cardiovascular risk. You can get non-alcoholic fatty liver disease, right? So you worry about that as well. And then again, you just get this chronic inflammation that is the base of so many chronic diseases. Thyroid disorders, hypothyroidism could be typically notable with PCOS as well. So lots of things there to consider with PCOS long-term health risk.
Not to mention, like you were saying, like the insulin resistance, which, and maybe I'm wrong on this, but I'm of the understanding that we're starting to type now PCOS and not all types come with insulin resistance. And maybe I'm misunderstanding that piece, but with insulin resistance, then also, again, we're more susceptible to those cravings. And then potentially maybe even more vulnerable to something like food addiction. Have you seen that as well in the patients that you work with?
So with women, typically I'm seeing, there probably is some element of PCOS. I'm not saying specific PCOS, but there's insulin resistant type PCOS for sure. And you'll kind of get everything we discuss. But basically, I think there's some women have also discussed the post-pill PCOS, right? So you get it after stopping control. And then there's like this inflammation. You can have adrenal issues. There's mild PCOS. There's a variety. And so I think really depends on some women, what their risk factors are. And so it's kind of like you say, you have hypertension, right? So there's different reasons and causes of hypertension. You can kind of think of PCOS as the umbrella. And depending on the cause, and I think you'd have to do more investigation with some blood tests and different things. But as far as PCOS in general, I think most of them come to me in the sense of insulin resistance because they're typically overweight. They have prediabetes or type 2 diabetes. They have all the signs and symptoms of being insulin resistant. There's certainly cases like, for example, diabetes. You could have your typical, what we describe as type 1 diabetes or previously known as juvenile diabetes. These are kids who get diabetes because their pancreas just stops producing insulin. Their beta cells are attacked. It's an autoimmune disease. Then you had what they had previously described as adult onset diabetes or type 2 diabetes now. This is the majority of diabetes. Again, you could say diabetes, but you have this umbrella. Then there's some interesting middle ground. You may see a late onset autoimmune of diabetes, type 1.5 diabetes, or LATA is another name for it. So there's, again, the umbrella, and then you have to fine tune it, right? Because I'm not going to treat my type 2 adult who's overweight the same as I would my type 1. So this is a discussion. And again, it's really important that you speak to someone who's a bit more of an expert and can get into the weeds for you instead of saying just, hey, you need this. But if you're lean and you have PCOS, right, and you don't have insulin resistance, this is a discussion you may need to speak to, again, to someone else, maybe see if there's some other medications or other lifestyle factors that we need to help with you with.
Yeah, because it does. It makes me think about, like that metformin making you more insulin sensitive, or even taking something like berberine or cinnamon, whatever. Like there's all kinds of options now that can really kind of, I guess, like support you on your journey as you're making these lifestyle changes. And that can also then like just curb that craving piece of it too, that can get in the way. I even ended up with gestational diabetes with my first pregnancy. And then in the second, they just kept me on metformin the whole time. So they took me off in the first pregnancy, developed gestational. And I don't know if then they were just like, well, we're just going to keep you on it the whole time, or they had new data. I'm not sure, but I know that was a while ago, and like things are always changing. So it's good to like, again, have a medical professional who is staying informed with the most up-to-date kind of information. So speaking about the mental health side of things, and now we know like the gut is kind of like the second brain these days. What role does that gut brain access then play in like hormone related food cravings? And how can our understanding of that then be leveraged to really manage something like food addiction, maybe?
Yeah. So I think this is territory again that we are just beginning to appreciate. I'd say in the last 2 decades, especially, but that gut brain axis it's really a complex communication, right? And so it's a network between the gut and the brain, right? So that involves hormones, things like neurotransmitters, and of course the microbiome, which is all the little guys that live in there. There's more of them than cells in your body, right? And then there's hormones like, the ghrelin and leptin, which kind of regulate hunger and satiety. And they're part of the axis and can really influence your cravings, right? So let's say that you have an imbalanced gut microbiome, and that can lead to increased cravings for certain foods, particularly sugars, refined carbohydrates. And I really want to emphasize refined carbohydrates. So some people, they say carbs, and what they mean is a bagel, but carbs people also mean by fruits and vegetables and whole grains. So when I say carbohydrates, we're talking about ultra processed, refined carbs. All of that can, of course, worsen inflammation, worsen food addiction because you get the highs and lows. And just really understanding that connection kind of help you manage food cravings by making you more mindful and focusing on your gut health through, again, the high fiber diet, which comes from those plants, fermented foods, which will help, put in the probiotics that we need to help replenish the gut microbiome, and possibly more prescriptive probiotics. But again, I would just be very careful about which ones you spend. You can spend a lot of money on supplements, probiotics that actually do nothing. So again, I would want to speak to maybe an integrative GI doc if you're really worried about your gut health. And but I'm talking about a physician who's gone through medical school, did internal medicine, did a gastrointestinal, and then also like integrative fellowship. So many people, and I'm not trying to poo-poo people have their place, but some specialties will start trying to practice outside of their specialty, and not even physicians, and they'll say they're experts in something and they have no business telling people what they're doing or what to do there. So just be very careful who and where you're getting your information, and do your due diligence. But anyway, when you support that healthy gut, that really can help you better regulate hunger signals, understand, intuitively what's going on in your body, and that kind of reduces the intensity of the food cravings when you have supported your gut health. Again, we're getting to the root cause. The root cause is so, so important.
Which, as you're talking about that, it makes me wonder about, so I'm thinking like, okay, insulin resistance, cravings, like mental wellness, all of these things that we all want to be balanced and good, right? I don't think anybody walks around saying, I want to be depressed or anxious. And I think about medical professionals who can be very loud now that we have social media, right? We have YouTube, we have all of these different platforms that people can be on, who are very loud about maybe even some like plants being, like you said, carbohydrates, and that like impacting insulin resistance, or people not losing weight because of the insulin resistance because they're still eating vegetables. And so maybe they need to go full carnivore, or that, plants are trying to kill us. Or I'm just trying to think of like some of the messages that I've heard or have been repeated to me from clients. And I'm wondering, like, from your perspective, can you give us maybe more of a middle of the road, like view on that?
As far as like, you mean on mental health?
Like plants and like how they can be like, are they actually negatively impacting our insulin resistance? Are they actually negatively impacting our mental wellness?
No. So so where do I even begin? Let me just highlight, I would say, my own experience, granted anecdotal, but the research absolutely. The reason I went to a whole food plant-based diet myself almost 13 years ago was because of a patient experience. And then the data, when I did the research, supported it. And now what I'm seeing over and over again, and I've seen thousands of patients. I am licensed in every single state of this country and DC in general. I started a company called Plant-Based Telehealth. I've seen patients in every single state. And there are so many stories that I could tell you about patients getting better. So I'm going to tell you my very first time that I understood the power of a plant-based diet. So I came from a traditional training, American training, family medicine. I was in the military. So again, you'll see a wide variety of experiences here. And you're always taught medications, more medications, right? You tell them to lose weight, but that was about all you're told, like how to help someone in factor in lifestyle. I had embraced the plant-based diet. I started developing a way of explaining this and sharing this with my patients. But when we talk about insulin resistance in and of itself, I had mentioned to this patient, was like, you could start a plant-based diet. I hear it can be very helpful, just in helping blood sugars. And I didn't even speak about the words insulin resistance. Like that just wasn't part of the conversation over a decade ago. And she was on insulin. She was a type 2 diabetic, insulin dependent. And within 72 hours, I had to stop 60 units of insulin. And if that doesn't grab your attention, then I don't know what rock you're living under, but that is phenomenal. And it's not even like she could lose a significant amount of weight in 72 hours, right? So this is someone who had been dealing with, worsening diabetes to the point that she required extra insulin, which is weight promoting in and of itself. So basically we're feeding the monster, right? So we start to put someone on insulin who's already, the little pancreas is churning out as much as it can. It's probably burned out. And now we're giving a huge amount of insulin. Typically, physiologically, you're going to produce around 25 to 35 units of insulin in a person who doesn't have diabetes, right? So just to give you some understanding of where I'm talking from. When you eat a whole food plant-based diet, and when you're thinking about the insulin resistance piece, there's a couple of things. First is you need to understand what causes the insulin resistance, right? So when we think about saturated fats, which primarily come from animal products and certain oils like coconut oil is not good for you. These things, you have a cell, especially the muscle, the liver, things like that. And when you eat food, it breaks down, let's say, the carbohydrates or glucose into your blood. And it needs insulin to enter the cells because that cell will take that glucose and create energy, right? And so it goes through its whole thing. But how does that glucose enter into the cell, right? So think of it as a door that has a lock on it. The insulin is released because the pancreas goes, oh, look, there's some glucose. I'm going to shoot out some insulin. The keys are floating around. Now the key enters into that keyhole, opens the door, and lets glucose in. That's how it's supposed to work. Now, it's a very simplified version, but I'm going to give you another thing. Now imagine they eat a highly saturated fat diet, high in animal products, right? High in oils, things like coconut oil, things like that are being advertised as healthy. There's nothing healthy about saturated fat. But basically now remember, I don't know about you, but my mom used to have like this glass, not the glass, but those metal like coffee cans, and she'd put like chicken drippings, like she'd fry food, she'd pour it in and reuse it. That I want you to imagine. Now with that keyhole, that stuff, that lard, that stuff that grossed you out when you looked at it is stuck in the keyhole, right? So now your body's like, oh, look, there's some glucose. Pancreas spits out some insulin, and the insulin key doesn't work. So the pancreas is going, there's more glucose. I guess I need to push out a little bit more keys. So it pushes out more and more and more, right? And so over time, you'll see your blood sugar rising, your fasting insulin levels are also increasing, and you start needing medication, you start gaining weight, because insulin resistance, again, is tied to so many things. Increased risk of heart disease, visceral fat increases, you have risk of cancers increasing, all, again, a variety of things occurring here. So when you eat a whole food plant-based diet, what you're doing is you're basically what you're doing is you're decreasing not only amount of saturated fat, but fat in general. I'm not a fat-phobic person. I'm a big fan of nuts and seeds, but you're eating fruits, veggies, beans, whole grains. These react very differently in your body than these ultra-processed foods. But like I said, we're dealing with lower saturated fats. The body's like, oh my God, finally, I've been being insulted with all these foods that I just have to do something with. You feed your body something, it has to do something with it, right? And so not only that, you're also not taking in cholesterol, right? So about 20% of your cholesterol that we measure in your blood is from dietary cholesterol. So now we've just taken a little bit of extra burden that your body doesn't have to deal with that. So you'll see your cholesterol levels down. You'll see inflammation down because, again, saturated fats are inflammatory provoking, along with some other components of animal-based products. So we're decreasing inflammation, which all exacerbate insulin resistance. And this amazing thing happens with fiber and the gut microbiome, and so many things occurring. Your blood sugars start stabilizing, and you'll start losing weight. And what you'll see is your need for insulin decreases. When I typically start someone who's on insulin and they're type 2 diabetic, I will either, depending on how much they're taking their sugars, I will many times either cut it in half on the very first day or stop it altogether. And because it's a very serious business that you don't want to overdose on insulin or medications for hypertension. So if someone, really embraces a whole food plant-based diet, and they're on hypertension medications or certain medications for diabetes, I give them very, very serious guidelines and when to reach out to me and what to do, because you don't want to cause some type of injury because of medications.
Yeah, that's so important. And thank you so much for sharing that, because I think, people have started to fear plants. And I specifically run into that a lot, mostly with fruit more than vegetables. But there is definitely that message out there that like plants are like, they've got these whatever, and they're trying to poison you and whatever it may.
No plant ever caused type 2 diabetes.
Got it.
There's, other than I would say don't consume oil, but then that's a processed food, right? That, coconut oil, things like that. And oils in general can be used in small amounts in a healthier person. But if someone's trying to lose weight, there's 120 calories of liquid fat in a tablespoon. Use it be mindful of what you're doing here, because to get 120 calories of the regular plant food, depending on what the plant food is, it's going to be hard other than nuts and seeds. But to get 120 calories of a banana, let's see, probably a banana and a half, kale, if you do your dark green leafies, that's pound or so or more. Definitely. So, you got to think about these things. But for the most part, there's no plant food that's ever caused type 2 diabetes. It's impossible. You just can't do it.
Excellent. Excellent. Okay. So thinking about, again, the client or patient maybe who's in perimenopause, menopause, PCOS, some sort of hormonal dysregulation is happening because it just is for whatever reason. What advice would you give that person who maybe also has come to you and said, I know I'm a sugar addict and I'm in perimenopause and I have PCOS or something along those lines? How would you help them? Like, how would their treatment differ from somebody who didn't come to you with the, I'm also a sugar addict? Is there anything that you would do differently? And what would it even be? What would that treatment be?
So if I say someone who's really struggling with, honestly, most of my patients are what you described, right? They may be never identified as having a food addiction or sugar addiction, but there's obviously a misalignment or an unhealthy relationship with food. So again, these conversations are very similar. And however, there are some people that may be triggered by nuts, right? Because they're high in protein, granted, but otherwise though, they're very savory, they're higher in fat, they can get them roasted, they can do all sorts of things, so they avoid nuts. Like I do have patients who are like, I can't have nuts in my house. So we move to chia seeds or ground flax seeds or something that's less, craving provoking. But peanut butter, like, I don't know, I could eat they'll say gobs of peanut butter in one sitting. So we just don't have it in the house. That's fine. So when we think about that, we highlight things that they might trigger them, right? And so help them understand your home needs to be your safe space. That's step one. But we have to start feeding your brain and body healthy foods, right? So we can decrease inflammation and just take care of the physical stuff. And what's interesting with that, many times you'll see an improvement in your mental health. I had a patient who had schizophrenia and she was on the appropriate medications, but was interesting. She was the best patient. I'd ask her to do something and she'd do it. It was fantastic. It was like the easiest patient ever. These are like your dream patients. But whenever she would go off the rails, let's say that she traveled or something and was unable to stay on her plant-based diet, she was Dr. Marbas. I start having her hallucinations, right? Even on medications. When she's on track and eating healthy, the inflammation decreases and she is fine. And so it's really wild. It was such an interesting thing that she observed in herself. And I think the other piece of this is the mindfulness aspect. And so I want to highlight a really interesting story. There's a woman named Dotsie Bosch, which you may or may not have heard of it. She was, at least at the time I interviewed her, she still had the record for Olympic track cyclists, where they ride really fast and scary in a circle and try not to, I just don't know how these people will kill each other. But she had won a silver at 38. And which was amazing, right? She's a plant-based athlete. And I think that's all, of course, phenomenal. But I'm like, what was really interesting when you did the research on her background prior to that, she was a history of a food addiction, right? She had an eating disorder. She would basically, bulimic, where she'd eat, binge, and then cause herself to vomit. And she also had a cocaine addiction. So So in my head, the more interesting conversation is, how the heck did you break that? Because that's what I want to know. And she said, it was really funny in such a nonchalant manner. She's like, well, I just found a therapist that would work with me. Okay. And she just let me do what I wanted to do. I was like, no, I'm really confused. And so what she did was she utilized a really interesting trick, which is basically mindfulness. And I'll highlight what she does. Like, okay, you're going to have to give me more details than that. So she said, well, I took these blue dots, and she told me to take the blue dots and stick them on things that triggered her. Okay. Now, if you're a food addict, you know there's going to be triggering moments, emotions, people, whatever, email, it doesn't matter. Whatever your trigger is, stick a blue dot on it. If it's a person, stick it right on their face, whatever you need to do. Okay. So that whatever that trigger was triggered the behavior. So now we're talking about a habit loop, right? You have a trigger, you have a behavior, you have a reward. There's some reason you are doing something, right? That food is satisfying some itch that can't be scratched unless you consume that particular food in that particular moment and whatever reason, right? So what she did was she goes, okay, she told me to stick these blue dots on these triggers, right, of whatever it was. So let's say it was the toilet, the refrigerator, the cabinet, didn't matter. She said, when I was going in the action, because what happens when you're in this process, when you're in the middle of this habit, you are now mindless. Your brain is not checked in. You are somewhere else. And I have my patients, typically we name the entity that causes these things, because it's not them, right? It's the addictive monster. It's Lulu, it's Karen, it's Bertha, it's whatever. These are just names patients have come up with. And we make it a joke because now we can separate ourselves, right? So we're becoming like, oh, look, Lulu's coming online. We're walking towards the cabinet. And so she would walk towards, let's say, the cabinet or the fridge. And she said the therapist told her to halt just for 30 seconds and become present. Oh, what? We have to stop. We see the blue line. The blue dot says, hey, brain, come on. Your thinking brain needs to come back online. And now we're being mindful. So, but there's a really important here, because we want to give you autonomy. So you see this blue dot. She says, start asking yourself some questions. How am I feeling? What was the trigger? How am I going to feel if I do consume this? Do I really want to do this? But it's in a non-judgmental, loving, compassionate way, right? Just like you would speak to a child. And after 30 seconds, you make a decision. You choose to engage in the behavior, or you choose to make a different choice. Now you're being mindful. And it doesn't matter. There's no guilt. If you choose to engage and indulge in whatever it is that you were wanting to, fine. But you made a mindful choice. The Lulu or the Bertha or the Karen didn't. And so she said over time, she goes, I would go through this cycle. And, the first few through 3 weeks, I was like 30 seconds. And, she used some language that I won't recycle here, but you can imagine. And she would engage in the behavior. But she said over the course of 2, 3, 4 months, after constantly reevaluating, is this really what I want? How she felt afterwards, right? So her mindful brain was engaged. The reward lost its value. And that, my friend, is how you break an unhealthy habit, is you disintegrate the reward. And guess what? The entire system breaks down and it falls apart. And that's how another patient of mine basically had one thing. This is a gentleman, I don't know if you've ever met, like the old guy. So I was in Western Colorado for a bit working, and
I live in Montana, and I work a lot with the ranchers.
Exactly. So this guy would walk in his cowboy boots, his cowboy hats. And I love these people. My dad was a truck driver. I mean, these are the people I grew up with. Eastern New Mexico, like rodeos when I was a kid. Like these are my people. And I was military. Plus, I get these people. I understand you. I come from you. And so the interesting thing was this gentleman, just the sweetest thing. You can tell someone either grew up in the South or in a home, or if they call you ma'am or stand up when you walk in the room, right? And so this is that type of guy. But he smoked 2 to 3 packs of cigarettes a day. And I tried everything. The scare tactics, useless. Saving money, useless. Didn't matter. I could try anything. And he's like, Dr. Marbas, I just like to smoke. Until one day he comes back and he goes, well, Dr. Marbas, I'll like to tell you that I stopped smoking. I was like, well, tell me what happened, because it was nothing I did, right? And so he's like, well, I was sitting in my chair. Can imagine, because they all have those big boy recliners leaning back, right? And he's probably puffing away. I just imagine it. For some reason, it's green. I have no idea why. But he's leaning back, and he says, my granddaughter came up to me. She's about 8. And he came up and was crying. And she says, Pop, he goes, honey, why are you crying? She goes, Pop, I don't want you to die. He goes, I'm not going to die, honey. And she goes, I learned at school, if you smoked it, you're going to die. And you smoke, and that means you're going to die. He said, right then and there, he put out that cigarette and never had the craving to smoke again. So now you can't tell me that in one instant, there was nothing rewarding enough to cause pain in his grandchild. And apparently, grandchildren are way more valuable and precious than adult children or children of any kind. I'm waiting. I put my order in. My 3 adult children have yet to produce anything for me, but I'm just sitting here waiting. But that's what I've been told. So I'm going to just believe that. And so that was enough to literally just cause his entire habit loop around smoking 2 to 3 cigarettes or 2 to 3 packs of cigarettes a day for 40 years, gone in an instant. Yes. So mindfulness is power. It is so powerful.
Absolutely. In cognitive behavioral therapy, we use vivid imagery. And I think that's what's it's getting at, is that it's a super powerful tool. So I'm thinking about the client who maybe is doing all the things and they're going through menopause, or they have PCOS or some combination. Would hormone replacement therapy then also be a tool that would help curb those, like in that instance? Like, would they, so if we're thinking like in terms of food addiction, would that then could that be the missing piece if they've tried all the other things?
Yeah. So let's remember, those symptoms of menopause can be ridiculous, right? And it literally makes women stop in their tracks and go, I'm going insane. And I think there's a blessing in the pain here, because it's the one time in women's life that they're forced to stop and reevaluate what's going on in their own physical bodies. Because we go along as women in this society and we serve others. We're constantly working. We're taking care of others. We're caregivers to elderly parents, to kids, to grandkids. We're doing anything and everything. And it's just nonstop, right? So you're already dealing with a bunch of stuff. And so now you throw in a little bit of menopause with no estrogen, which is the queen of everything in the body, apparently, because I learned that myself. Now it just exacerbates everything that you're already dealing with. So if you had food addictions, they're worsening because you're more stressed, you're not sleeping, so you can imagine you just have this exacerbation of things maybe you were dealing with, but it's kind of like that pot that starts to bubble and you see the lid starts to come off and then it just blows off. You're like, F this, I'm blowing up. And so that's where we're at, right? So when you think about it, I think in some cases, the menopausal hormone therapy, or HRT, what it used to be called, can absolutely reduce, the food addiction piece, especially if you're going through that perimenopause, menopausal, because we're balancing hormones. It can alleviate the mood swings, it reduces your cravings, and again, just improve your overall well-being. And it just makes it easier, I think, to deal with your eating behaviors. Again, but just remember, HRT is not suitable for everyone, but it is something that should be discussed with a provider that knows what they're doing. But yeah, absolutely. But I still highlight the need for a good, healthy diet, exercise, all those things. But even like I said, even though you might have been doing all those things, menopause can come and whack you upside the back of the head like it did me. And I'm like, this happened. And you're picking yourself off the ground and going, holy moly, someone help me. And I just had a whole new understanding of the women who had come to me for decades before and what they were describing. Oh, I get it now. Oh, I get it. Really good.
Yeah. I talk to my clients all the time too. We can be doing all the things right and snapback can still happen. So, we can be doing all the things we need to do to be safeguarding our recovery, and something like this can come along and just wreak havoc. But to know that there are interventions, there are things that we can do. We just double down, or we stay consistent in the things, because I think there's a lot of crossover in the lifestyle stuff that helps support all of that. So it's just so good to know that there are other options and that there's somebody like you out there, like helping people. So where can our listeners find you, and how can they work with you if they want to?
Sure. So everything is at drmarbas.com. So it's drmarbas.com. And you just scroll to the bottom. There's a little way if you want to make an appointment. I don't accept insurance. I have gone through that process. So when we started our first company in 2020, we were cash only. Then we sold it. We sold our company to John Mackey, who started Whole Foods. And then I started another company called More, and we really started working on doing lifestyle medicine, group visits, accepting insurance. And I have never in my life I mean, I have an MBA, so I understand the business aspects of things, but this was so insanely, expensive, complicated. There are thousands and thousands of different type of insurance plans and rules and regulations. Just getting licensed in all 50 states is an interesting thing, but I digress. Yes, I'm licensed in all 50 states and DC, so I can see women. I'm in as well. Majority of my patients are women across the country, and you just book an appointment there. Now, if you do have insurance that it does out of network, I can give you, or an HSA or FSA, I can give you what we call not a bill, but it's called a super bill. It's basically a receipt of service, and you can submit that to your insurance company for reimbursement.
Yeah, amazing. Okay, so we have a signature question. So before you go, if you wouldn't mind answering, if you could tell a younger version of yourself something about hormones, perimenopause, menopause, PCOS, and food addiction or sugar addiction, what would that be?
Honestly, I would tell my younger doctor self that 20 years ago, as I was entering into practice and as a young physician, don't just think the research is everything, right? So you have to listen to the story and really pay attention to what these women are telling you, and don't tell them just to suffer, right? And to know that, Laurie, even people who are doing everything well are still going to potentially have severe symptoms. Hence, why I'm telling my daughter who just turned 30, I was like, and I asked her, she just went through one of the top family medicine training programs in Boston, just graduated in June. And I'm asking her, and her partner is OB-GYN at Harvard. I'm asking these guys who are at the height and the best institutions in our country, what are you learning about perimenopause and menopause? And it is minimal, right? And so here we are, yet again, producing doctors who want to do good, who don't have the education. So I would be telling myself, educate yourself early and often. And I would say the same for any woman, right? So, again, go to reputable organizations like the Menopause Society. That's a very good one. You can also connect with, if you need someone in person, someone who's actually been certified in menopause care, which I'm working on getting in October. They only offer the test twice a year. And so these are things that you can absolutely connect with someone. And if not, you can't see them in person, maybe you can connect with someone via telemedicine and at least air your concerns, and they can give you advice on who to look for and what to do and what to request from even those who maybe you have a physician or a provider who is sympathetic and compassionate and they don't have the knowledge, but maybe you can help get them the knowledge. So don't be afraid to bring information to your physician or provider, because many times, they're humans too, and they're dealing with their own stuff, and they're just the exhaustion that comes with medical practice is getting harder and harder to deal with. We're dealing with a very sick population, especially here in the United States. So, have some compassion for your providers, but they should be doing their job, and they should do their job well. You are still need to be their number one priority when they're in conversation with you. So don't, if you're not feeling good about what you've been told, seek help elsewhere.
Beautiful. Thank you so much again, Dr. Marbas, for being here, for answering all of my questions, and just being a valuable resource that we can direct people to. I just appreciate everything that you are out there doing.
Thank you so much. I appreciate it. It was a lot of fun. This is some of my favorite stuff to talk about. So thanks for having me.
Thanks for joining us this week on Food Junkies Recovery from Food Addiction. Make sure to join our Facebook group, Sugar Free for Life Support Group. I'm Sweet Enough. Molly and Clarissa are food addiction professionals who offer one-to-one counseling and group coaching through Sweet Sobriety. Please subscribe to our show so you never miss an episode. While you're at it, if you found value in today's episode, we'd appreciate you leaving us a review on your favorite platform. Your feedback helps grow our show and allows us to reach others who need to hear this message of recovery. Don't forget to pick up a copy of Dr. Tarman's book, Food Junkies. And as Vera always says, the power is ours.